Looking for ways to treat irritable bowel syndrome naturally? Watch this video for my 3-step guide on how to manage irritable bowel syndrome naturally for lasting relief. For the best natural healthcare advice and tips, subscribe to my channel and hit the bell icon so you could be notified every time I post a video on a Friday. I work with many patients in my practice who are struggling with irritable bowel syndrome and help them successfully overcome IBS using individualized natural treatment plans including nutrition and natural remedies, and I know I can help you too. Let's first understand what is IBS, what causes IBS, and how is it diagnosed. IBS is called irritable bowel syndrome. It is a collection of symptoms. It is not a disease, hence it's called a syndrome. For example, you might visit your doctor complaining about recurring constipation, diarrhea, gas, bloating, stomach or abdominal pain. Your doctor might ask you to undergo various tests to rule out more serious conditions such as Crohn's disease, celiac disease, or even bowel cancer. The tests are meant to indicate if there is a structural abnormality with your digestive tract. When the tests are negative, then they might say that you have IBS. There are no tests to indicate that you definitely have IBS. The good news is that you have ruled out serious health conditions. However, IBS can still be really difficult to deal with on a day-to-day basis and could affect your quality of life. Please note that if you notice bleeding or blood in your stool, you need to contact your doctor immediately as this could indicate more serious conditions. What causes IBS? IBS might have many potential causes. In my practice, I've seen patients with IBS that was caused because of yeast overgrowth or candida, food sensitiveness, stomach bug or GI tract infections, SIBO, small intestinal bacterial overgrowth, lack of good gut bacteria, exposure to environment toxicity, sluggish liver, long-term use of antibiotics, anxiety and stress, hormonal disorders, and decreased immune system function. No two individuals are affected by IBS in the same way. The extent of physical, emotional, and mental symptoms always differ, and most importantly, the root cause. I get asked by a lot of my patients during the first consultation as to why the conventional medication is not offering them lasting relief. The reason for that is it is not aimed at the root cause of the problem. For example, you might be prescribed antacids for constipation and other drugs for dealing with gas, bloating or diarrhea. However, the root cause of the problem is not addressed by any of these drugs. Hence, when you stop your medication, the symptoms return. So let's look at my 3-step plan on dealing with IBS naturally for lasting relief. Step 1. Understanding the root cause of IBS. I recommend this to all my patients even before the first consultation. This will help you understand the root cause and the triggers for your particular IBS symptom. The easiest way to do this is to maintain a food journal and make a note of what you eat during the day. You can either use a free app or make a note on your phone. So you're going to record what you eat for breakfast, lunch and dinner and how you feel after each meal. You can rate your symptoms on an intensity scale of 1 to 10. 10 being the highest intensity. Also mentally note how certain foods make you feel. At the end of the day, make a note of your stress and anxiety levels, again on an intensity scale of 1 to 10. I recommend maintaining this journal for a minimum of 1 week. The second way is to get a blood test done to check for any food intolerances, allergies, vitamin deficiencies, mineral deficiencies, your blood sugar levels, and any yeast infections. So maintaining a food journal and getting the blood test not only helps you understand the root cause and the triggers, but it also gives you a baseline for the treatment. So before you make any changes to your lifestyle or diet, you have a baseline on where you were, the intensity of all the symptoms which you can compare after your treatment and see the difference. Lastly, the most overlooked factor when treating IBS is anxiety and stress. Although we might not be able to eliminate stress from our life altogether, committing yourselves to making small steps in order to eliminate stress goes a long way. Switching off work after a certain point in the evening Making sure you allocate time to spend with family, with yourself, spending time in nature, practicing yoga and meditation go a long way. Comment below and let me know what IBS symptoms you are suffering from and if you have any IBS related questions that you want me to answer. Step 3. Adopting holistic health care for treating IBS. IBS affects each person differently depending upon the root cause, the mental, emotional and physical symptoms that a person is displaying. I've had huge success treating IBS with homeopathy and nutrition. This is because of the treatment approach, which is individualized and is aimed at the root cause of the problem and how the symptoms are showing in a particular individual. Contrary to conventional medication, where you are prescribed multiple drugs to deal with each of the symptoms, a homeopath looks at the symptom picture of a person and understands the root cause of why the person has IBS in the first place. The treatment is aimed at curing the root cause and offering you permanent relief. Customized diet and nutrition plan not only offer relief from IBS but also helps boost your overall gut health, your immune health, and might help you lose weight. I often get asked in my practice about the supplements my patients could take during their treatment for IBS. My first response to that is to have a healthy, nutritious diet which will give you all the nourishment you need. But if you're keen on taking supplements, I recommend starting with good probiotic supplements and then complementing with zinc, magnesium and vitamin D supplements. Now you know exactly how to treat IBS naturally for lasting relief. I've written a 5-page guide on how holistic healthcare can help in IBS treatment. I will leave the link for the document in the description below. Also, if you are interested to join a community of people who are suffering with IBS, I have a private Facebook group where I share up-to-date advice and tips on how to deal with IBS. I will leave the link for the Facebook group in the description below. If you found this information useful, give it a thumbs up, share it with your friends and family who might be suffering with IBS, and let me know if there are any IBS topics that you want me to cover in future videos.